Hello everyone, I'm Jordan Black, and this is going to be a presentation on TCM, acupressure, versus Swedish massage. So some of the topics of discussion in this presentation will be touching up on TCM. A lot of the acupressure points and concepts are built from TCM, so we'll be touching on two quick slides there. And of course, what is Swedish massage? We'll be hitting the history, the treatable illnesses, the diagnosis, and the equipment for both modalities, some differences and similarities, and lastly, the closing remarks of the presentation. So, what is TCM? TCM is a style of traditional medicine built on a foundation of more than 2,500 years of Chinese medical practice that includes various forms of herbal medicine, acupuncture, acupressure massage, tuina, exercise, qigong, and dietary therapy. One of the basic ideas of TCM is that the body's vital energy, qi, circulates throughout channels called meridians that have branches connected to bodily organs and functions. Concepts of the body and disease used in TCM reflect its ancient origins. Yin and Yang. Yin and Yang is an ancient Chinese concept which can be traced back to the Shang dynasty. It represents two abstract and complementary aspects that every phenomenon in the universe can be divided into. The concept of yin and yang is also applicable to the human body. For example, the upper part of the body and the back are assigned to yang, while the lower part of the body is believed to have the yin character. Yin and yang characterizations also extend to various body functions and, more importantly, to disease symptoms. Cold and warm sensations are assumed to be yin and yang symptoms respectively. So carrying on, what is TCM acupressure? Acupressure is essentially a method of sending a signal to the body to turn on its own self-healing or regulatory mechanisms. Normally, qi, vital energy, circulates through meridians in the body. Blockage of this flow or an imbalance of yin and yang can cause illness and pain. Acupressure helps to correct functional imbalances and restore the flow, thus returning the body to a more natural state of well-being. The role of acupressure has been paramount in traditional Chinese medicine for more than 2,000 years, and the fact that it is still in use today is a testimony to its effectiveness in the treatment of illness and pain. Acupressure is an effective form of stimulation used to help relax the muscles. If done regularly, this method of self-manage can sustain, improve, and minimize reoccurrence of symptoms. The history of acupressure. Acupressure, acupuncture, and TCM have been practiced for over 2,500 years in China. From 1929 to 1949, the influx of Western medicine to China made it so the government outlawed all forms of TCM and other natural medicines until a new government that saw the healing effectiveness brought it back for standard healthcare in 1949. Acupuncture research institutes were established in the 1950s throughout China, and treatment became available in separate acupuncture departments within Western-styled hospitals. In 1971, an American reporter for the New York Times wrote an article that is largely credited for bringing the concept of TCM acupressure to North America and to the North American public. So some of the common treatable illnesses for acupressure, there's a lot of them. So the general ones would be allergies, asthma, sinusitis, headaches, TMJ, back pain, musculoskeletal problems, insomnia, anxiety, dizziness, depression, high blood pressure, chronic fatigue, fibromyalgia, addictions, indigestion, constipation, sexual dysfunction. Under women's health, it would be menstruation or menstrual irregularities, menopause, conception difficulties, pregnancy, childbirth, location difficulties, postpartum, ovarian and uterine problems. Under men's health, it would be prostate issues, infertility, and impotence. Under pediatrics, asthma, cough, digestive problems, behavioral problems, ear infections, sleep problems. Under preventative care, stress management, wellness, and seasonal attunement. So getting into the diagnosis of acupressure, massage, and TCM diagnosis, getting into the diagnosis of acupressure massage, it's all generally based off of TCM diagnosis, and TCM has 4 main points of diagnosis. The looking examination, this is an examination that involves the observation of all aspects of a person: complexion, demeanor, manner of walk, body shape, skin anomalies. The looking examination frequently focuses on the tongue. Specific changes in the tongue's color, shape, coating reflects specific changes in the vital substances and or internal organs. For example, a pale, swollen tongue with teeth marks and a thick white coat may indicate a deficiency in qi. The listening and smelling examination. This examination relates specific sounds and smells of an illness to specific patterns of disharmony. For example, a loud barking cough indicates an excess condition, whereas a weak cough indicates a deficient condition. The asking examination. The patient is asked a series of questions about sensations of hot and cold, level of thirst, appetite, and bowel movements. The practitioner also asks detailed questions about diet, exercise, lifestyle, work habits, and exposure to pathogenic factors. The answers help direct the practitioner to the pathological process occurring. The touching examination. Areas of pain or discomfort are felt by the practitioner to determine the cause of the dysfunction. The pulse is usually felt. In conventional medicine, the pulse indicates qualities such as speed, strength, and regularity. In Chinese medicine, the pulse is used as a diagnostic tool. The radial pulse felt on the wrist is divided into 3 different positions, and each position has 3 different levels. Each pulse position is related to a Zhang Fu organ. There are 27 different pulse qualities that supply information. Pulse taking is difficult to learn and takes years to master. An example of pulse quality is a wiry pulse, which feels like a guitar string and may indicate that qi is stagnant. And finally, to wrap up, acupressure massage is the equipment. It's just a massage table, massage oil, clean white sheets, a pillow, and a blanket, and potentially some nice music. Moving on to Swedish massage. What is Swedish massage? Swedish massage is the most common and best known type of massage in the West. It's the foundation for other types of Western massage, including sports massage, deep tissue massage, and aromatherapy massage, and is based on the Western concepts of anatomy and physiology, as opposed to energy work on meridians like in TCM. A Swedish massage can be slow and gentle, or vigorous and bracing, depending on the therapist's personal style and what he or she is trying to achieve. The massage therapist normally uses long strokes, pressure, stretches, and friction to loosen tight muscles. So a brief history of Swedish massage. In the early 19th century, the Swedish physiologist Per Henrik Ling at the University of Stockholm developed a system called medical gymnastics, which included movements performed by a therapist. These became the known as Swedish movements in Europe, and the Swedish movement cure when they came to the US in 1858. So what are some of the treatable illnesses of Swedish massage? Research has shown that massage can reduce heart rate, lower blood pressure, and increase blood circulation and lymph flow. It also relaxes muscles, improves range of motion, while increasing endorphins, which all can enhance medical treatment. Therapeutic massage does not increase muscle strength, although it can stimulate weak and inactive muscles. which helps compensate for lack of exercise and inactivity caused by illness or injury. Massage can help treat stress-related physical conditions, including anxiety and depression, fatigue, headaches, and migraines, pain, including muscle tension, back, shoulder, and neck pain, repetitive stress injuries. So the diagnosis of Swedish massage is pretty limited. Swedish massage is a form of relaxation and does not necessarily have a set group of protocols that practitioners follow to treat different illnesses. A practitioner may change a treatment to focus on a specific area for more relief or relaxation if desired by the patient. And again, the equipment is going to be the exact same as acupressure massage. It includes a massage table, massage oil, clean white sheets, pillow, a blanket, and potentially some music. So, lastly, the similarities and differences between acupressure and TCM versus Swedish massage. So first, the similarities would be the equipment. They're both very much the same. And secondly, the end goal is to heal and relax. So relaxation is there. Now on to acupressure. It includes a complex diagnosis that Swedish massage lacks. It was developed in China with some different views to Western medicine. It treats a larger amount of illness compared to Swedish massage. It's a preventative lifestyle, and really it is a lifestyle. It's not just acupressure. It's you gotta do it all to really get the full effect. And it's part of a larger system. And now on to Swedish massage. It's generally more accepted, developed within Western medicine. It's more of a reactionary medicine. And lastly, it generally only deals with musculoskeletal problems and relaxation. Thank you for your time. It's greatly appreciated. And this is the end of the presentation.